Hello, welcome to the third video of the Swimming Upstream with Data series in rural communities. I am Dr. Beverly Triana-Tremain, or Bev. I'm the epidemiologist from the South-Southwest Prevention Technology Transfer Center. If you have not watched the overview to this data series, please do that. It will provide you with important information about the concepts presented in this series. We'd like to make this acknowledgement. This presentation was prepared for the South-Southwest Prevention Technology Transfer Center Network, or the PTTC, under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The purpose of today's recording is to highlight a few data sources that are important for rural communities. Understanding rural data allows us to see where inequities may exist and the needed interventions to reduce these inequities. The purpose of today's recording is to highlight a few sources of data for rural communities. And we will see all the different resources available to you, at least 4 of them. And so the first one we will start with is the poverty area measures from the U.S. Department of Agriculture and the Economic Research Service. We will then visit the Census Bureau and learn more about rural geography and how they rank rural settings from most rural to mostly urban. We'll then visit the county health rankings and roadmaps, a very popular site to look at mental health features and other risk and protective factors and outcomes. We'll also visit the Opportunity Atlas. This is where we'll look at opportunity indicators that might indicate certain outcomes in a community, in rural communities. Okay, so we have a lot to cover, so let's get started. This is the United States Department of Agriculture Poverty Area Measures. And if you were to scroll down after visiting this site, you would see 2 documents available in Excel spreadsheets. You can click on the poverty area measures in an Excel format. Okay, you click on this and it will download for you. The first thing you'll see is the first tab in this spreadsheet. It has all of the documentation information where the data are collected, the variables, and the years available. You'll then see a code book of the codes they give the particular variables, for example, region in the United States. Okay. You'll then see county public health data. And it's very important when you're looking at this spreadsheet here that you look up at the very top, at the top row, you will see particular variables, such as a high poverty rate at 60% of the federal poverty level. That is a variable and it's coded. So you will need to revisit your code book to learn what these codes mean. And all throughout the spreadsheet, you will find there are codes and there are variables on the top row. So this will give you an idea about the poverty levels in the particular counties. If you look at column D, you will see the county names and the state names. And this spreadsheet provides that for all the states in the union. When you visit the United States Department of Agriculture again, you will see the rural-urban continuum codes. This is another data source that provides you information on how the government codes areas in our nation. And they are not either rural or urban, they are a mixture of 9 different categories from rural to urban. And it's called RUC codes. That's short for rural urban continuum codes. So when you visit the link, you will see a variety of different links here. They go back all the way to 1974. And much has been learned about how we code settings in our nation and how we can study that information to understand what the risk factors and protective factors and outcomes are. The very first file you want to open is the 2023 Rural Urban Continuum Codes. Those have recently been updated. You click on that and you will be provided a file. You'll see documentation here. These are codes, right? And then you will see the actual data. You'll see the state, you'll see the county name, the population from the 2020 census, the RUC code, and that goes from 1 to 9. And you will see a description for each code. For example, if we look at Bibb County, Alabama, you will see it is coded a 1, and that is a metro, counties and metro areas of 1 million population or more. Okay. Here is the county health rankings and roadmaps. You can find that at countyhealthrankings.org. This is a wonderful site with tons of data on factors in the community that could indicate health outcomes. And the County Health Rankings was created by the University of Wisconsin and the Robert Wood Johnson Foundation. And if you click on health data, you can do health data by location, and you can scroll down and you will see an image of the United States. You could click into a certain state and you will see, for example, Texas. You see the surrounding states, and then you see a county map of Texas. You could click on any one of those counties and it will give you more data for Kent County and more data for health outcomes. You could click those different counties and then you could compare counties as well. You could also, if you go back, you can, if you scroll back up here, you can download the entire Texas state data. Okay, so you could do the whole state all the way back to, I believe they started in 2010. Okay, and you can also look at the entire nation if you wish. So for example, 2024 data sources, you can open that file and you will see a county health rankings and roadmaps, select measures and data sources. This gives you more information about the data collected for all states and for all counties. Back at the main site, you can look at health data again, and you can do health data by location again, and you can scroll down. And look at the county health rankings model. This is very important in that you will see that the outcomes, the health factors, and the policies and programs are what you are trying to change. And these are the factors that the county health rankings looks at, collects, and gathers in a repository for you to be able to use to look at what your county is experiencing. Okay. This is the Opportunity Index at opportunityindex.org. When you visit this site, you will be presented with a national map, and you will see various counties in here. And for example, you can see an overall opportunity presented in the map. You can also drill down into these variables that affects opportunity. So if you look at the overall economy, these are particular variables that could affect the ability to have a necessary income, and that obviously could affect your health outcomes. When you're looking at the national map here at the Opportunity Index, you can click to drill down into a smaller county view. So you can click county view up here in the tab. Let's say, for example, we want to go to New Mexico, and we can click on a county there, and it will bring up for us this Chavez County in New Mexico and provide for us all of the indicators such as opportunity score, economy score, education, community score, and health score. And it will give us the various rankings for the United States, other counties that are similar, and New Mexico as a state, and then the county that we are interested in. You can go up here and look at different years, for example, 2016 to 2019. So here we are back at our data mountain. We covered the U.S. Department of Agriculture poverty area measures. We also covered the census bureaus and looked at rural geography and how they code counties of various sizes. We looked at the county health rankings and roadmaps where you can look at mental health data and other indicators. We also looked at the Opportunity Atlas, where they use about 4 categories that describe opportunity in a county. For more information, do not hesitate to contact us. Our emails are presented here, and we have other videos available in the Upstream Data series at our YouTube channel. Thank you for listening and have a great day.